Hi, I'm Dr. Derek Thiel with Max Health Chiropractic. Today I want to take you through the 5 essentials with pregnancy. The very first essential is what we call maximize mind. We need to make sure that we're having the correct mindset as we are going through the pregnancy process. One of the worst things to do is be stressed out when we are pregnant. Stress is going to be harmful not only for our bodies but also for the bodies of our unborn child. So we need to make sure that we're decreasing the stress as much as possible. When we think about stress, many future parents, they get very nervous about the due date. The due date is just a halfway point. What that means is that half the time the baby's going to be born before that date, half the time the baby's going to be born after that date. We want to make sure that we're not getting stressed out due to the due date. Also, remember, childbirth, it is a natural process. It's been going on for thousands and thousands of years, so it's going to be a natural process. We don't want it to be, we don't want to get stressed out over it. The next essential is maximize nerve supply and spinal biomechanics. As we're looking at the spine, it's important to make sure that the spine's lined up correctly in order for the birth process to take place the way that it should. As we look at the spine here, this is called the pelvic inlet. As pregnancy is taking place, there's a hormone release that's called relaxin. Relaxin actually helps the ligaments to relax in the body. So this sacrum in the pelvis, it has to shift. That has to be able to pivot. When the spine's lined up correctly, this pelvis can shift as the baby's head goes through the birth canal. If someone is subluxated, or if their pelvis is out of alignment, if it's crooked, that sacrum's no longer going to be able to shift and the baby's not going to be able to go through as easily as possible. What that means is those whose pelvis is lined up correctly with chiropractic care, it's been proven to be a more pain-free delivery, a more pain-free pregnancy, and actually faster labor times as well. The next essential that we're looking at is maximize nutrition. We need to make sure that we're putting good supplements and good vitamins and nutrients into our body. There's a few main supplements that is very important during pregnancy and some prenatals as well. The first is a woman's multivitamin. We need to make sure that not only our bodies are getting the supplements that we need, but also the baby is getting the supplements that it needs as well. The big component to this is folate and folic acid. That's going to help to prevent neural tube defects. The next supplement that I have is Optimal Omega. This is omega-3 fish oil. What this is, it's very good for the nervous system. It helps the baby's brain to develop correctly and the baby's nervous system to develop correctly. And finally, we have vitamin D with probiotics. Vitamin D is great for not only your immune system, but the immune system of the unborn child. And the probiotics give an extra good bacteria and good healthy gut flora for the mom and the child. Looking at the third essential is maximize exercise. When we are going through pregnancy, during the later stages of pregnancy, we don't want to be exercising as extreme. However, it's very, very, very important to stay moving. One of the worst things to do is to be sitting down all day. We need to get motion into the spine, we need to get motion in the back. Exercise is going to be very healthy for the child. Few good exercises are going to be using a pelvic disc, a wobble disc, also lots of walking as well. If you'd like more information on some great exercises for pregnancy, check out our website and we'll take you through some exercises specifically like that. And the final essential, the fifth essential, it's minimizing toxins. Now, as one's going through pregnancy, we need to make sure that we're not putting alcohol, tobacco, caffeine, none of that can go in the body. But also, if you think of things like lunch meats, those may cause listerosis, which is very bad for the unborn child and can cause lots of damage to the baby as well. So once again, thanks for tuning in. I'm Dr. Derek Thiel with Max Health Chiropractic. Hope you learned something, and we'll see you soon.